Hello, my name is Mackenzie West, and I'm going to be covering autism spectrum disorders, abbreviated commonly as ASD. So, I wanted to begin with this short clip from Saturday Night Live. This is Elon Musk, of course. He co founded Tesla, he founded SpaceX, he just acquired Twitter. He's a Twitter CEO right now. He's also the richest man in the world. And here he is on Saturday Night Live announcing to the world that he has Asperger's. And Asperger's falls under the ASD, autism spectrum disorder umbrella, which I'll touch on a little bit in the next slide. But the world really was receptive to him coming out and announcing this. And Elon Musk is not the only famous person who has autism spectrum disorder. There's an incredible list, including Albert Einstein, Tim Burton, Charles Darwin, Bill Gates, Michelangelo, Steven Spielberg, Jane Austen. So there are really a lot of people who have autism spectrum disorder, and some people are very successful. And that's not to say that everybody who has autism spectrum disorder is going to be the same, but there are people who go on to become, very successful, very functioning people. And so I think this was just a good one to start with.
I'm actually making history tonight as the first person with Asperger's to host SNL.
The American Psychiatric Association publishes the Diagnostic and Statistical Manual of Mental Disorders. This is the 5th edition, the most recent edition of the DSM, and it's basically the psychiatric Bible, for lack of better terms. And the DSM-5 outlines a myriad of mental disorders and mental health conditions, and it classifies autism spectrum disorder as well. And within that, autism spectrum disorder is based on 2 behavioral domains, and these include number 1, difficulties in social communication and social interaction, and 2, unusually restricted repetitive behavior, interest, or activities. So kids with autism spectrum disorder are going to exhibit symptoms and signs that correlate with these DSM conditions. And autism spectrum disorder is essentially an umbrella term for 5 different disorders, and these include Asperger's syndrome, Rett syndrome, childhood disintegrative disorder, Kanner syndrome, and pervasive developmental disorder. So if you're talking to somebody or somebody mentions that, or for Elon Musk, for example, if you hear somebody say, my child or this person has Asperger's syndrome, this is classified as an autism spectrum disorder. So autism could include Asperger's, Rett, childhood disintegrative disorder, Kanner syndrome, or pervasive developmental disorder. It's now being frequently diagnosed in toddlers. This is because as more and more is learned about it, there's better education. Parents are able to recognize these, and then they can get professional evaluation, and then they can get diagnosed earlier. About 1 in 68 children in the US will be diagnosed. This is about 15 for every 1,000, or about 1.5% prevalence in the United States. It's interesting to note that it is 4 times more common in boys than it is in girls. And autism spectrum disorder is not related to socioeconomic level, race, or parenting style. So really kids from all walks of life can be diagnosed with autism spectrum disorder. It's not linked or specific to any one group. So autism spectrum disorders are complex neurodevelopmental disorders of unknown etiology. So there's nothing set in stone, nothing is known for sure. However, there are several theories that work to explain how autism spectrum disorders come to be. Some of those theories include hereditary, genetic, medical, and immune dysregulation or neural inflammation. The oxidative stress theory explains it by damage to cellular tissues, and then there's environmental factors as well that could affect the development of autism spectrum disorders. The strongest evidence for the genetic basis comes from studies done on twins. There seems to be a high correlation between identical twins for autism spectrum disorder prevalency. So that's about 60 to 96%, and then a lower prevalence for not identical twins, which is about 5%. There is a high risk of occurrence for families with an affected child, which again goes on to add additional material for the genetic side. Um, but overall, a child may exhibit a series of some of these, or all of them, or none of them. But they may exhibit an abnormal EEG, epileptic seizures, delayed development of hand dominance, persistence of primitive reflexes, increased in serum serotonin levels, cerebellar vermis hypoplasia, which is a decreased size of the cerebellum in the brain, and then infantile heart enlargement, which is just exactly what it sounds like. In recent years, there has been a strong anti vaccination push, and a lot of this anti vaccination push comes from the idea that these vaccinations cause autism spectrum disorders in kids. However, it has been long proven that there is no scientific evidence or link between autism spectrum disorders and the measles, mumps, and rubella vaccination or any thimerosal containing vaccines. Thimerosal is a preservative that sometimes still is used, but since 2001 they phased it out. But it's used as a preservative, and the concern with it is that it's 50% mercury, and mercury is harmful for humans. However, thimerosal is easily excreted from the body. It's safe for humans. But like I said, since 2001, thimerosal has been taken out of most childhood vaccines anyway. It's still in some flu vaccinations, but these can be requested to be given to the child without the thimerosal formulation. So it's important to, when parents come in with these concerns for vaccinations and autism spectrum disorders, you can help allay their fears by reassuring them that there is no link between these autism spectrum disorders or any vaccinations. There has been recent reporting and retrospective studies on certain conditions and scenarios that tie autism spectrum disorders to them, and these are prenatal and perinatal events such as maternal and paternal ages over 40 years old, uterine bleeding during pregnancy, low APGAR score, fetal distress, and neonatal hypobilirubinemia. The researchers, though, who found these links and these correlations urged caution in interpreting or linking these findings to autism spectrum disorder, but it is out there for you to know. The clinical manifestations of autism spectrum disorders are going to be primarily social interaction, communication, and behavior deficits. The hallmark of autism spectrum disorders are going to be those failures to interact socially and develop communication as to be expected for their age group. And every child is going to be different, so they may exhibit some of these or all of them or a mixture of them, but they're going to be abnormal eye contact. A lot of people with autism spectrum disorders don't like to make eye contact. It makes them uncomfortable. It can be overly stimulating. A decreased response to their name, decreased imitation. They might display usual repetitive behavior, so they may do the same thing over and over. They may exhibit verbal delays and motor delays. And then commonly, autism spectrum disorder, patients with this disorder are going to experience significant gastrointestinal symptoms, especially constipation. And this can be due to the acquired megarectum. The idea is that there is mitochondrial dysfunction, which causes decreased gastrointestinal motility and causes this constipation. But sometimes these kids also have diarrhea as well and abdominal pain and distension. Manifestations again vary between children. There are mild forms that require little supervision with accommodations. The child can grow up to have very fulfilling marriages and families of their own, successful work careers. Sometimes these accommodations are learned. Some autistic children and adolescents learn to do something called masking, which is imitating neurotypical behaviors to prevent the social stigma of autism, spectrum disorders, or so that they can fit in better. And some manifestations are severe. With some of these severe manifestations, self abuse is common, and these children require intense and lifelong supervision. There are savants, which is despite relative moderate to severe disability, these children with autism can go on to excel in particular areas such as art, memory, music, mathematics, or perceptual skills like puzzles. Savant syndrome is incredibly rare. This is Kim Peek. He is considered to be a mega savant. He was the inspiration for a 1988 movie called Rain Man. Kim Peek had a IQ of 87, and in some of the videos you watch with him, you can tell he's extremely uncomfortable in social situations, but he had nearly perfect recall. Kim Peek was able to, if you're looking at an open book, his left eye could read the left page and his right eye could read the right page, and he was able to read novels within an hour, full length novels within an hour with perfect recall. So he's an example of a mega savant, savant syndrome. Communication impairments are common in children with autism, and they can range from delayed speech to absent speech altogether. A child should be brought in for immediate evaluation by a professional if the child is not babbling or gesturing by 1 year old, is not having single words by 16 months old, or no two-word phrases by 2 years old. Some children display what is called autism regression, and this is when the child is on track and meeting milestones for their age group. They're developing normally, and then all of a sudden they regress and they go backwards, and this is a red flag. The American Academy of Pediatrics recommends that pediatric healthcare providers administer 2 separate autism spectrum disorder screenings, and these occur at well child visits at 18 months and 24 months. Any valid test can be used, however, the best and most reliable is the MTACC-H8T/F, or the modified checklist for autism in toddlers, and the F is for the follow-up interview if they flag positive. It's been shown that even minimally trained primary care pediatricians can administer the screening test reliably. And then if the child flags positive, the child should be referred for a comprehensive developmental evaluation with a developmental pediatrician, child neurologist, child psychiatrist, or a child psychologist. The best way to improve outcomes for these children is to recognize early, get them referred, diagnosed, and provide intensive early interventions. Diagnosis is often not made until about 2 or 3 years old when these children begin to miss these developmental milestones. However, most parents with autism spectrum disorder children, in retrospect, realize that their children displayed atypical behaviors prior to those 24 months. So education can be very important. So these children can be seen and evaluated and provided early interventions to improve outcomes. The sooner the better. Autism has no cure. However, with early interventions, some children with autism are able to achieve independence. However, for some children with autism, many are going to require lifelong supervision. Some research has indicated that when parents are the primary mode for delivering interventions, it can improve outcomes. And also, the prognosis is more favorable, so the child is more likely to have a more independent life when they have higher intelligence, functional speech, and less behavioral impairment. Therapeutic intervention for children with autism spectrum disorders requires often specialized and advanced training. However, many children with this condition exhibit many comorbid conditions such as aggression, self injury, asthma, and epilepsy. So it's likely that a nurse will encounter a patient with autism throughout their practice. So there is no cure. Again, there is no cure for autism spectrum disorder, but there are many possible therapy modalities. A structured routine proves to be very helpful for these patients, and also just highly structured and intensive behavior modification programs. Alternative therapies and complementary medicine has been on the rise, and maybe you've heard of or seen some of these. These include certain supplementations, a ketogenic diet that's low in carbs and high in fat, parents giving massages to their children, and force fat riding, but ultimately further research is needed. A nurse is likely to encounter a child with autism within their career, so it's important to know how to address these specific concerns for these patients. Ultimately, the parents are going to know the child best, and every child's different. So seek guidance from the parents, ask them what works, what doesn't, what to avoid, what to promote, and encourage the parents to stay with the child as much as possible to alleviate stress. All children are going to be different, so what works for one child with autism isn't going to necessarily work for the next. But there are a few things to keep in mind. Typically, decreasing stimulation, so making sure this child has a private room, not a shared room, avoiding visual and audio distractions when you're trying to care for the patient, and giving them their favorite possessions. Maybe this is a stuffed toy or blanket. Physical contact can be overstimulating for a lot of children, and this can be counterintuitive because touch can be therapeutic for other children. So, minimal holding and minimal eye contact, as well as brief visits with the child from the caregiver, and being very direct with the child what they need to do or what you want them to know. Another thing is to be mindful with care and feeding. Children with autism can be fussy eaters, so they may starve themselves if they don't like what's being offered, or they may, on the other side, attempt to eat anything available. So these could be both edible objects or foods, and or they may try to eat inedible things that they have access to, like medical instruments or scissors, for example. Autism can become what's known as a family disease because it involves the often constant care and support of the family. So, nurses should provide family support in addition to support for the child. Make sure the parents know that they are not the cause for the child's condition. Give them referrals and advice on where to go for expert counsel. Autism Society website gives a lot of information, and then local and state departments can give information as well as offer home care, educational services, and other services to meet the child's needs. Families are encouraged to care for the child in the home, and for children that require lifelong supervision, referring the parents to resources that are going to assist in finding long term placement for the child after the parents pass are important.